I'm in conversation with Xavier Abade in France. His company is called Simforhealth, and I've invited him to tell us a little bit about himself and his company and what's happening with COVID-19 in France and the products and services that he developed. So, Xavier, how long have you been involved in digital healthcare?
Well, first of all, David, thank you very much for having me here. I've been involved in digital healthcare for the last 4 years, but before that, I have had a quite long, I should say now, history in the medical environments altogether, including medical devices, logistics. So I've done for the last 30 years, quite a lot of different things and at different positions in the healthcare area in France, but a lot also in the international environments. I did was GM for a medical device company based in France, producing in Germany and selling worldwide needles for anesthesia, and did also some consulting for my own company for a couple of years, and then joined Simforhealth 4 years ago in charge of international developments. So Simforhealth is an editor, it's a digital company, and our goal is to digitalize the healthcare environments to provide our customers with simulators to train them. So we train we train nurses, either on initial or continuous environments, education, in all different aspects or therapeutical areas.
And what would you say would be the area that's got the biggest growth or demand in healthcare simulations in your experience?
Recently, we have had a lot of demand in oncology. Basically, we have two main streams of revenues. We work with universities, faculties, hospitals to provide mostly initial training for students. And we also work with the industry to provide continuous training for their KOLs, their doctors. So we work with all the big names of the pharma industry or the medical device industry to provide ad hoc, tailor-made trainings depending on the needs. We have a big focus on oncology and cardiology, which would be, I would say, the two main field of therapeutical areas that we cover, but namely we can do any kind of different areas.
So have you got an involvement in virtual reality? Is that going to be a big growth area?
Yes, we do have virtual reality already. As a matter of fact, a lot of people do think, because we've communicated quite a lot on that we are a VR company, which is not the case. Most VR is like 15% of what we do. The rest is screen-based simulators. But VR is very spectacular, and we have worked and very soon in our developments. I joined in 2016, and very early 17, I was lucky enough to be in the CES show in Las Vegas, and we had a booth there as a very small French company at the time, and we were awarded with our VR, one of our first VR simulator, as one of the 4 most innovative companies of the CES 2017. So that was for us a big achievement that led us to work with very prestigious universities like Stanford in California on a VR surgery program. Well, prior to surgery program for their residents.
Okay,
so
and
that was great.
Yeah, your VR applications, accepting that they're just a minority part of your business, are they typically single user applications, or are they collaborative VR applications?
We have both. We have single users, and we have also worked on collaborative VR experiences, mostly for private customers. But we have, for example, worked for a quite large insurance company in France that had an issue that they wanted to train their customers in the OR for. which was the beginning of a fire in the OR. So we worked on a scenario where there is, of course, a surgeon, where there is an anesthetist, where there's a nurse, and everybody can collaborate and work together on the same VR environments. I would say that's one of the key elements of what we do, and our offer is a platform, internet-based platform called MedicActive, where we can host all our simulators, and that can allow people that are not specifically at the same place to connect in the same environments and join the same VR environments.
That's fantastic. So with COVID-19, how are you responding or adapting to that in France with yourself and with your company's products?
Well, in France, the situation is very hard at the moment, and we were one of the first country in Europe to be hit by the virus. So it's a very tough situation at the moment. I would say that the cynical way would be to say that as a distance learning or digital education company, of course, that would be for us some kind of interesting moments. But what we decided very early is that we worked on two major axes. The first one, we got in France a program that is for nursing, initial education, and we have worked with the French referential system for nursing education, and we've developed 9 simulators that can be accessed by computer or tablets. And we've decided very soon to let the access of these 9 simulators to all the nursing schools that will make a demand to us for the time when students cannot go to the class because we cannot move, and we are in a very strict stay-at-home moment in France. So any French school that is requiring an access to this program just has to email us, and we open them an account, and they can log into this platform that I was mentioning before and create their input their students and access to the simulators. And we have also expanded this to French-speaking countries. Unfortunately, we don't have it in English right now, but we have extended it to Belgium, to Switzerland, but also to North Africa, to the Maghreb countries like Morocco, Algeria, and Tunisia. Okay. The other way of what we're doing for COVID-19 is in the platform, and this was I think what I would like to highlight. In the platform, we have what we call an authoring tool. This tool enables any healthcare professionals that has no specific IT knowledge to create his own simulator. It's virtual patient, so it's a consultation-based program. But when they open their accounts, they kind of get into a big library. They can choose their avatar, they can choose their environments, and they can write down the script, the scenario of a consultation, and it transforms into a digital program that then can be accessed by anyone that makes the request to access it. So the model there usually is that the creation and the hosting of the content is for free, and then the sharing of the simulators is based on the subscription model. Basically, you have a number of students that is equal to a number of licenses. And if you have 100 students, then you buy 100 licenses and you can share your contents. We have decided to let this free also. So every content that has been provided on related to the COVID-19 has got a free access for anybody involved in the healthcare community. So this can be done in English and in French so far. And potentially, to give you an example of what has been done, one of our good customer in Morocco, who is a professor, is the president of the Moroccan Association of Simulation. He did a simulator using this tool, and he broadcasted it 2 weeks ago on an e-congress in Morocco that gathered on YouTube more than 70,000 views. So it's all in French, but it really is very powerful too.
Well, well, congratulations with that, and I'm very glad to hear your progress in this sort of area, and I'm very grateful for you to join us at the conference tomorrow. So I look forward to speaking to you again tomorrow in the panel discussion. Thank you, Xavier.